is Joanna Kerr. I'm a librarian at London Central Library. We're happy to partner with the Rotman Institute of Philosophy and the Department of Philosophy at Western University to bring you this program. There are 2 more sessions in this series after tonight, happening on the next 2 Thursdays in November at 7 p.m. To register, go to the Rotman Institute website or check the library's online programming calendar. Tonight's talk is Individual and Collective Responsibility and Interest During COVID-19 with Tracy Isaacs. And the host of tonight's program is Eric Desjardins. Eric is the Associate Director of the Rotman Institute of Philosophy and an Associate Professor in the Department of Philosophy at Western University. His research interests include the philosophy of biology, the philosophy of science, and environmental philosophy. Before Eric starts our talk tonight, we would like to take this time together to acknowledge that we in London, Ontario, are speaking to you from the traditional lands of the Anishinaabe, Haudenosaunee, Huron-Wendat, Lenape, and Neutral peoples. This land is covered by several treaties, including Treaty 6, the London Township Treaty of 1796. We acknowledge historical and ongoing injustices that Indigenous peoples endure in Canada. We are grateful for the opportunity to meet here, and we thank the generations of peoples who have taken care of this land. Together and going forward, may we recognize our own responsibility in the stewardship of this land. To learn more about Treaty 6, the library holds materials on this and other treaties and land sessions. I'll include these titles in the chat. And now I'll turn the program over to Eric Desjardins. Thank you.
Thank you very much, Joanna, for this introduction. Welcome, everyone, and welcome back for those who are here for the second event in this series. We have tonight another great speaker. It's my pleasure and to introduce Tracy Isaacs, who's Associate Dean in the Faculty of Arts and Humanities at Western, and she's also professor in the Departments of Philosophy, Women's Studies, and Feminist Research, also at Western. Her research focuses on issues of responsibility in collective action context, collective obligation, ethics, and feminist ethics. And she also works in something that I've learned by looking at her biography. She works on feminist issues in sport and fitness, food, dieting, and body image. So tonight, she's going to talk about collective actions and collective responsibilities and interest, also individual, and not just collective, but individual. In time of COVID-19. But before leaving the screen to Tracy, I would just like to remind everyone that this event is recorded and it's live. And so the way it's going to work is that we're going to have Tracy's talk for about 30 minutes or so, and then there's going to be a period of question. So to ask questions related to the talk, you can use the Q&A function, so it's the button at the bottom of your screen there. But if you have any questions related to technicalities or how to use Zoom or things like that, then you can use the chat, and the question is going to go to one of the panelists who's going to answer it. So with no further ado, Tracy, the screen is yours.
Thank you, Eric and Joanna. Thanks for organizing this. We've been doing the library lecture series, partnering with Philosophy in the Library lecture series for decades, and never done it on Zoom before. So welcome, everybody. This here is an outline of what I'm going to talk about tonight. And if you're like me, you're trying to make morally responsible decisions in the context of the COVID-19 pandemic. And I think most people are like me in this respect. And most people want to make informed, ethically responsible decisions besides the day-to-day of whether or when to dine indoors at a restaurant, or whether or when to go grocery shopping as opposed to have your order delivered, or whether or how frequently to see family or friends for indoor visits with masks, without masks. We have also some more gut-wrenching decisions to make about important family occasions. Like for me, the next would be Christmas. I already chose to give a pass on Thanksgiving, which is my single most favorite weekend to visit my parents at their home in Haliburton. And I had two reasons for skipping that annual trek to the Kawartha Lakes region for Thanksgiving. One, the visit was not worth the risk to my parents, who are both healthy and active, but also in their early 80s, and so more vulnerable to experiencing a bad case of COVID if they get it. But also it was not advisable in terms of the public health. And indeed, our public health experts were asking people to stay put and to minimize close contact with people outside of their households. As they are now, the pleading is getting more desperate this week. London, Ontario is not a hot spot, but going to Haliburton involves a 4 to 5 hour drive, and I would likely have to make at least one stop, and Haliburton has even less COVID than London. And I respect the expertise of our public health officials. So in other words, I thought of staying home for Thanksgiving as doing my part to contribute to the collective effort to stop the spread or slow the spread of COVID-19. Most of us, given the current state of knowledge about COVID-19, rising case counts, and the limits of our healthcare system, think of this as a reasonable collective goal. There would have been no legal consequences to me choosing differently to decide to go stay with my parents that weekend. This was an entirely ethically guided choice on my part. So, side note, philosophers use the words ethical and moral more or less interchangeably when we're talking about principles of right action. And that's what I want to talk about tonight. I want to talk about the ethical or moral dimensions of individual choice and action in the collective context of the pandemic. There are also legal and even political considerations. If you're like most people, you're committed to following the evolving laws and bylaws. If we're supposed to put a 10-person limit on indoor private gatherings, you respect that limit. If we're supposed to wear masks in indoor public places, you wear a mask. For that, we just need clear communication. Let's hope we're getting it about the expectations and we're on it. But there's a whole range of choice that's not covered by the legal and that requires some moral balancing. And for these decisions, we might be guided by the question, if I believe in and I'm committed to doing my part to achieve the collective goal of slowing the spread, how might I best do that? My purpose tonight is not to tell you what choices you should make, though I do have some thoughts about what choices people should make, but that's not my goal tonight. Instead, I want to talk about how to think about the choices we make so as to make ethically informed and ethically better choices and feel more ethically invested in these choices in the sense of feeling as if we are effective moral agents helping to achieve a worthwhile outcome, like our actions make a difference. My main goal is to provide ethical reasons not to slide into what I call exceptionalist or overly individualist thinking. Exceptionalist thinking takes place whenever we reason in ways that secure the conclusion that we get to do things that others who are similarly positioned don't like. Yes, it's better if more people stay home, but I get to go out because I'm low risk. I live alone. I don't have COVID. I think by now we've all had that encounter with someone who coughs or sneezes and immediately says, I don't have COVID. Really? Do you know this to be true? Did you get tested? We know that everyone always assumes that they and their not always, there's positive diagnoses, but because of asymptomatic infection, we know that people assume that they and their loved ones don't have COVID. But the climbing COVID numbers tell us that at least some of these people are wrong. In my work on moral responsibility and collective context, which is really the main field that I work in philosophy, I spend a lot of time considering collective actions in the context of large global challenges that require a collective response if they are to be solved at all. So climate change, oppression, global poverty, industrialized agriculture and its impact on both human and non-human animals, just to name a few of the issues. All of these require a coordinated effort if they're to be resolved. The coordinated effort requires that we mobilize collective agents, organizations, nations and governments, corporations, and even less formal groups, what in my work I call goal-oriented collectives, where people come together in solidarity around shared goals. So for example, Black Lives Matter. In the terms of the metaphysics of action, which we will venture into a little bit tonight, I am after all a philosopher, this means that there are some actions that simply cannot be performed by an individual alone. We can think of this idea that there are some actions that an individual alone cannot perform in really simple terms. Think of the wave at a sports event, or even more simply, doing a tango. These are essentially collective undertakings that cannot be pulled off alone. Nevertheless, they require the participating individuals to do their parts. That is, without individuals acting together with a joint goal in mind and an explicitly coordinated effort to achieve like an effective wave or a dramatic tango, the action just is not possible. Now, of course, doing the tango or making a wave at a sports event are not collective actions with obvious ethical dimensions, but taking action against climate change, addressing social injustice and oppression, reducing or even eliminating global poverty, or ending animal suffering are all collective undertakings with important moral features. And so is slowing the spread of COVID-19. You or I alone cannot do that. Like climate change or oppression, like addressing those things, it requires collective effort. It requires people to act together in the service of the shared goal. We see, and perhaps even at times ourselves engaged in exceptionalist thinking, it's super, super tempting, where we consider it okay for us to act in ways that in fact endanger the public health, take risks. I'm going to argue that this type of thinking is a form of rationalization based on a failure or sometimes a refusal to see ourselves as playing a part in a larger picture. That is, it's a very individualistic approach to reasoning that doesn't take adequate account of the collective context in which we are acting now. And I'm going to argue that when we do that, we are acting wrongly, and in the terms of moral responsibility, we are blameworthy for our choices. So what do I mean by moral responsibility? Many philosophers, myself included, think of moral responsibility simply as praiseworthiness or blameworthiness for our actions and maybe for our characters. So when I do something good or right, I'm praiseworthy. When I do something wrong, I'm blameworthy for my actions. That's rough and ready. There could be times when I act wrongly, but I have an excuse that exonerates me from blame. So when I contribute to some harm, but I'm not aware that I'm contributing. There could be times when I act correctly or do things with good consequences, but I'm not necessarily praiseworthy because the good outcome might have been accidental, not what I intended. But the basic idea is that when we speak of moral responsibility, we're speaking of blameworthiness and praiseworthiness. And generally, I'm fairly optimistic about human nature. I'm not a psychologist, but I think most of us don't want to act in blameworthy ways. Even if we reason wrongly sometimes, which we do, we're human, most of us want to do the right thing. What I'm going to do now is take a little detour into an area of philosophy called action theory. This is what I did my dissertation on about 30 years ago. And I'm going to use action theory to explain how the way we describe our actions can give us more or less information about their moral dimensions. And then we can use this information to make ethically informed choices. So in the philosophical field of action theory, philosophers try to understand what actions as opposed to events or mere happenings are. Within action theory, there's this view that's held by a number of philosophers, but most famously 20th century philosophers, Donald Davidson and Joel Feinberg, in which actions are just bodily movements that may be described in certain ways. So for example, I might move my finger, and in so doing, I might flip a switch. This is a famous example in Davidson's work. In so doing, I might turn on the lights. In turning on the lights, I might alert a burglar. According to this view, the same action, moving my finger, might be described in a number of different ways, and yet there's still just one action. It's not that different from the way a person might be described in different ways. Your neighbor, your friend, the neighborhood gossip, the best gardener on your street, and yet there's just still one person, not many. The descriptions that we use for our actions give us information about them. And some of these descriptions give us information about the action's moral dimensions. For example, let's go back to moving my finger. Well, I might move my finger, but we might also describe that as pulling the trigger. And depending on what happens when I pull the trigger, we might also describe that as killing my neighbor. And depending on the circumstances, it might be correct to describe that as murdering my neighbor. So like as with the light switch, moving my finger, pulling the trigger, killing my neighbor, murdering my neighbor, these are all different descriptions of the same action, but some give us more morally relevant information than others. Like killing is bad, murdering is really bad. And sometimes appropriate descriptions of our actions make reference to a much larger context, what I call a collective context. For example, if that killing of my neighbor, sorry to give such gruesome examples here, but if that killing of my neighbor takes place as part of a genocide, which is typically a collective undertaking that just one individual cannot accomplish alone, then we might consider it a contribution to genocide. And that identifies a description that adds a further moral, not just moral quality to the action, but a collective dimension to the wrongful, blameworthy action. So again, murder is bad, but genocide is arguably worse. So adding that information to our description, to our action, gives us more morally relevant information. So these collective descriptions that invoke moral or ethical dimensions of our actions don't always draw attention to negative. So you can think of like running a 5K. We might rightly describe an action as running a 5K. That might seem morally neutral, no ethical dimensions. But what if I did it in the context of the Terry Fox run? And so I raised a lot of money for a worthy cause. In that case, taking account of the collective description of my action as making a contribution to cancer research gives us access to moral information about my action. It's a praiseworthy action. It's laudable. If all you know is that I ran 5K, you don't have any awareness of the moral qualities of my action. I didn't just run 5K. I contributed to a collective effort to raise money for the Terry Fox Foundation. So now I want to link this idea of different act descriptions, giving us different and sometimes morally relevant information about what to do, to making decisions as an individual in a collective context like COVID. My view is that it is often the case that when we engage in exceptionalist thinking, what we're doing is we are setting aside or ignoring the collective levels of description of our actions. Those are the descriptions of our actions that capture what I think of as the part we play, the contribution we make in a larger context. That is, maybe I think of choosing not to wear a mask. I always wear a mask, but maybe I think of choosing not to wear a mask as opting for comfort. Or perhaps I consider visiting my family for Thanksgiving as keeping up family traditions or getting a welcome break from the city. But in much the same way as the example of genocide, there are other descriptions with important moral dimensions that ought to be, and that are actually, especially relevant and especially salient during the pandemic. And one such description may very well be contributing to the spread of the virus. We might also describe this. Remember, we can describe these things in different ways to get more information. We might also describe it as increasing the number of COVID-related deaths or contributing to the overwhelm of our healthcare system. And these descriptions of my action tap into that collective level of concern. It's not just about me and my so-called close contacts. It's not just about whether I'm going to put my parents at risk. Instead, it appeals to the difference my action makes to the collective good. And in this case, in COVID, today, now, this week, the public health and the measures that we need to take as a community to slow the spread. And in this case, that difference is harmful. In equal measure, our contribution could be positive. It could be helpful. So when I think of my contributions to the public health, I can make harmful contributions or I can make helpful contributions. And when we're thinking through this question of how might I best contribute to slowing the spread, it's easy to think whenever we're faced with a large, like seemingly insurmountable global issue, it's easy to think, what difference does my action make? And there are actually two angles that we could take on this question. So there's the get away with it version. That depends on the goodwill of others. You know, if the reasoning is something like if enough other people do their part, my little action's not going to make things any worse. In this case, I reason in such a way that I minimize the impact of my actions, and that just allows me to continue doing whatever the heck I want, because other people are doing what needs to be done. So that's one version. There's also the despairing version, like what difference could my little action possibly make to such a huge problem? How can I make a difference? And in this inflection of the question, we reason that our efforts are fruitless, and so we feel powerless and ineffective as agents. We feel like this situation is spinning out of control. There's nothing we can do to help. Both of these approaches are wrong. So I don't want to say too much about that first version, the free rider version, the one that lets me get away with doing less if others do their part. That's classic exceptionalism, whereby I don't feel like I have to do my part if enough others are doing theirs. And I used to spend a lot of time worrying about this sort of self-centered egoism, we call it in moral philosophy. Plato makes us confront this question in the Republic, when Glaucon argues with Socrates and claims that if we could be made invisible, like Gyges when he put on his magical ring, we would get away with as much as we could without being caught, because we'd be invisible. But I've come to the conclusion, remember my optimism, that most people are more motivated by the desire to do the right thing than to get away with it. And I'm much more concerned with helping people think through their moral quandaries. There are enough people who are genuinely interested in doing that, genuinely interested in thinking through how to land on what should I do. So I'm more interested in talking to those people than to someone who can't be reasoned with. I don't want to bother trying to talk people into seeing that they're wrong that much anymore. I still think free riders are wrong, though, in that they're literally morally wrong because they fail to be moved by legitimate moral reasons, and they display either affected or otherwise culpable moral ignorance. They don't consider the impact of their actions in the larger scheme of things, but only in respect of their own individual good. And I don't think most of us are like this. I think most people actually care. So this brings me to the way our contributions actually do make a difference. And if you're someone who worries about being an ineffective moral agent in the face of massive and overwhelming challenges like climate change or COVID, you might feel more heartened and even more effective when you think about the collective context in which your action takes place. And I think this really does contribute to a sense of taking part in something that does make a difference. So have you ever been to a sports event where you wanted to get a wave going and no one else seemed to want to play? It's frustrating, right? Like one person, standing up and throwing their arms overhead does not a wave make. But have you ever been at an event where you were part of a successful wave? And hasn't that made you feed off the energy of others, feel motivated to keep it going for a few rounds? It's that coordinated actions, those coordinated actions of many that actually make that moment a successful case of collective action, where a group of people acting together successfully achieve a collective outcome. That same action, if performed all alone, would result in nothing. But when it's performed together with others, it has an impact. It's quite dramatic. When we're faced with these overwhelming challenges of a grand scale, we can be effective as agents when we act in concert with others, when we engage in coordinated acting together. And it's actually the collective goal that helps determine how and when we can effectively act in its service. So, for example, it doesn't do any good for me to stand up and throw my arms overhead like this when the wave is on the other side of the arena. That's not how it works. I have to wait for my moment. So knowing what we're trying to achieve together lends a more determinate shape and purpose to my choice. Decision-making under COVID is like that. And to the extent that it is like that, we need to take that collective goal into account in order to make decisions about when and how to act, because our actions do make a difference. So let's go back to my deliberations about whether I should visit my parents for the holidays. At the beginning, I suggested that we should be guided by the question, if I believe in and I'm committed to doing my part for the collective goal of slowing the spread, how might I best do that? Well, at a minimum, I need to follow the provincial COVID measures or the municipal ones or whichever ones are in play that are legally required at the time. If gatherings are limited, I respect that limit. If masks are required in indoor public spaces, I wear a mask in indoor public spaces. But what if it's not required, but public health officials and our premier and our prime minister, as they are now, are kind of strongly encouraging us to take more conservative measures voluntarily, not to visit family members indoors, not to engage in these extra risky activities on the grounds that doing so will contribute to spread. And that's where I must not lose sight of the collective picture. I must not overlook the part that I play. We know that we're dealing with an invisible threat. We know we're dealing with a virus that can be spread asymptomatically. We know we can't always be 100% confident unless we've been quarantining for 14 days that we are not a vector. So are there ways that I can visit without increasing risk? Well, these are the things that I need to think about. We're aware that isolating can reduce our role as vectors. Can a period of isolation make it possible for me to go? Does my living alone and therefore being exposed to very few people make a difference? Okay. So I confess, well, my mom and dad are here, so I'm not going to announce some dramatic decision, but I confess that I haven't yet landed on a decision. And the main point that I really want to leave you with tonight is that in my deliberations about this, and also in your deliberations about various decisions that you're making in your own life, we are at risk of doing the wrong thing from an ethical perspective if we leave out that collective context in our deliberations. If we do that, we risk overlooking these important collective descriptions of our actions that might indicate their ethical dimensions that just looking at the individual level of description won't indicate. And when I'm thinking about going home for the holidays, those are the features of my actions that I must not overlook. Thank you.
Sorry. Thank you very much, Tracy. That was very good. So now we're going to pass to the section where you can ask questions. So just reminding you that you can use the Q&A function for that. And I'm going to receive your questions in the background. So Deborah and Laura are working very hard in the background here to have this event work successfully. But I'm going to start with a question of mine, since I'm the chair, so I have this power here. So I'd like to go back to your example of the wave in a sport event. So in my youth, a little while ago, actually quite some time ago, so I did go to one of those sport events, and with some friends, we decided to try to start a wave. And it was a lot of work, to be honest. It took many attempts before it finally worked and went around maybe a couple of times. We were so excited about the thing. We were feeding off the energy of it. So my question here is that there are going to be moments where the action is not just following the rules, and it's going to be even going further. There's going to be a significant effort to put toward to maybe start a movement that you think is morally right. And so I was wondering whether you can speak of that. So the examples you were using is well, should I not contribute to spreading the risk? But sometimes it's not just not contributing to some harm, it's actually moving something so that some harm is. So is there something you would like to say about that?
Yeah, how do you get these things going?
Yeah.
So I've been thinking about this for decades because, I've been watching the slow rate of cultural shift with respect to feminist issues and racism and other forms of oppression. And it is really hard to have movements really take hold. I don't know if I want to call it an advantage, but one advantage, if you will, of the pandemic is that it affects everybody. It doesn't affect everybody equally. We know that there are differences along certain dimensions like poverty, race, and gender. The vast majority of care workers in the long-term care, for example, we know there are differences in age and how it affects people of different ages, but it does affect everybody in the sense that everybody is susceptible. And so, whereas with some movements, and I don't know why it's so hard to get a wave going, but with some social justice movements, what makes it difficult to get them going is that not everybody equally experiences the marginalization side of oppression. Some people experience the privilege side, and it's much more difficult to wrap your head around social injustice if it doesn't affect your day-to-day life. So I think that's one reason why it's hard to get these things going. And it's often a slow start. I mean, if you know, I've been interested in watching how the climate change issue has really seemed to take hold in the past few years in a way that it hadn't even 10 years ago. And so sometimes people need to experience it as a crisis before they're gonna act together. But I think knowledge is really important. And so the more we know, the easier it is to mobilize people. Like, it's very difficult to jump on board with something that you're uncertain about or skeptical about, which is, again, one of the reasons why privilege makes it difficult for people to get invested in some social justice movements. But once that knowledge is there, you can be moved by the knowledge. And in fact, knowledge creates moral obligations.
Yeah, thank you. Yeah, that's good. That's why all this misinformation is also worrisome.
Very dangerous. Like, it's so harmful.
Yeah. So now we have quite a few questions here coming in. The first one is from Robin, and she's asking, so what do you think the role of our political leaders is in coordinating collective moral actions? Do they have more responsibility for clearly communicating our individual responsibilities? What do you do when political leaders make confusing decisions and unclearly public health messaging, as in the case of Ontario currently?
Yeah, well, certainly political leaders have a huge obligation to communicate clearly, especially about things that have legal consequences. I mean, if there's suddenly a whole new raft of laws in place where we need to know what those are. So that needs to be clearly communicated. But there's a lot of mixed messaging. I think one of the struggles that I'm having in the Canadian context right now is we've got the Prime Minister saying a bunch of stuff, encouraging the provinces to take stricter, clearer measures, and so he's appealing to the premiers, and then he's also appealing directly to citizens. And then we've got premiers making individual decisions within the provinces, and then we've got local health units making decisions. And in a way, I can see why, because the situation's not the same in London as it is in Toronto. But at the same time, it's very difficult to make individual decisions when you're getting so much information that's different and, in different places. And, but yeah, I mean, politicians, leaders have an obligation to, governments are collective entities that need to offer clear communication for the kinds of decisions that they're being made and the reasons that they're making those decisions. And I don't think we're doing a great job right now, but we're doing a better job than some.
Yeah, no, it's a difficult one to navigate. Yeah.
Well, there's also a lot of changing information, so I don't want to underestimate how difficult it would be to be a leader right now, because there is a lot of changing information. There's constant new research. There's rising case numbers, and like there are a lot of things that need to be balanced. So that is true.
Good, thank you. So our next question is from Andre, And Andre is asking, what if one is convinced that not enough people are doing their part, so that there's no point? So should one act as if there is hope anyway, like with climate change?
Yes, I think so. Because, well, I think there are two things. One, act as if there's hope, but also maybe take a stronger role in making people aware. So, you know, one of the missions that I'm on really is to try to give people, I mean, maybe my conceptual, maybe I've been doing philosophy for too long, but I think having a kind of conceptual framework that helps us understand our actions as part of a larger thing can actually be empowering, because it's pretty depressing to think that with respect to climate change, my actions make no difference, or because we're really in a bad way with respect to the climate. And the more people that we can kind of convince to make changes that might have a positive outcome, if a critical mass of people did them, the better. Like, it's the only way. The gains might be incremental, but hopefully, as with many movements, over time, we transition to more and more people jumping on board. And I think the only way to do that is to kind of keep the faith in a way and be a good role model and talk about it whenever it's possible.
Yeah, thank you. So the next question here from Mason. So could you...
I saw Mason's question, it's very long. Maybe I should look at it while you're reading it.
Okay, so could you differentiate between ignoring collective moral dimensions as opposed to deliberately obfuscating and rationalizing my actions as individually ethically permissible? So
okay, so yeah, I mean, I guess there's a continuum of bad, worse. So I would say the maybe the least culpable would be one that you're not mentioning, which is just not knowing. Like, simply, I don't know. I just don't know. Although that might be, you maybe have an obligation to inform yourself, because we are in a pandemic. And so find some good information sources and rely on them as much as possible. But the difference between ignoring the collective dimensions and deliberately sort of, well, I guess I don't quite understand, so ignoring them as opposed to deliberately obfuscating and rationalizing my actions as individually ethically permissible. I'm not sure I grasp that difference very well. Maybe the second way is like deliberately failing to acknowledge or deliberately setting aside information that you know to be morally relevant. That is not an excuse for anything. I mean, if I know, like, you can't just cover your ears and go la 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 and pretend that these are legitimate descriptions of your action. So if you're trying to set them aside, you're not adequately acknowledging what the impact of your actions are. I don't feel like I've answered your question very well, but.
Okay, well, maybe we
That's kind
can
of what I have to say then. We can
move on.
engage about that. I'll message you.
Okay, or maybe it's going to come back.
Maybe.
So another question here from Isaias. Sorry if I mispronouncing your name here. So how should we respond to competing values with respect to achieving a collective goal? So for instance, contact tracing apps presented a privacy issue, which was in competition with the value to prevent harm, that is ameliorate COVID spread. How would you respond to this?
Right. So there's often competing values, and we need to obviously prioritize values and try to address them. So my understanding of, for example, of the contact tracing app that we ended up with is that it doesn't identify individuals. It doesn't, that app tells you when you've been in proximity of somebody who's tested positive, not who that person was. And only if they say that they tested, only if they tell the app that they tested positive. So I know that a lot of people kind of refer to the very vigorous contact tracing that happened like in South Korea, that completely ignored privacy considerations. And I just think that in our society, we do have to balance those things, that we're never going to have an outcome where you have no control over who has your health data. I mean, for example, I work at the university in the dean's office as the associate dean. We are not entitled to know which of our students has tested positive for COVID. Often they will tell us, but just as with any health issue, we don't have a right to know the details. The health unit does, and they're the ones in charge of contact tracing. And I really like the way, I'm going to use this moment to kind of applaud the way the CBC has been handling the reporting of school outbreaks. So they'll say there was a positive test at such and such a school. The London Middlesex Health Unit, or the Middlesex London Health Unit, is engaged in contact tracing now to determine that person's close contacts. The school is open. If you are a close contact, you will be contacted. Like, otherwise, keep going to school, because they're not going to announce like it was, Sally in the grade 3 class. So I think we do have to balance those values. Of course we do.
Yeah. Thank you. So our next question from Eugenia. So how do you argue against trade-offs across moral problems? So again, going back maybe to balancing values here. So for example, anti-vaxxers believe they are morally superior because they believe they are opposing an hegemonic pharma industry. So they assume that action surpasses any commendable effort, such as collective immunity.
Well, I mean, yeah, so trade-offs. So I think sometimes people are just wrong in the kinds of trade-offs they make. Taking a stand against big pharma, I don't know enough about anti-vaxxers to know if that's just like a socially acceptable way that they can, my understanding of anti-vaxxers is that most of it is based on bad science. So I'm sorry, I'm just going to say that. And so if your view is based on bad science, then we don't, you know, like that trade-off is not a legitimate trade-off to make. I'm not sure how many people are I actually just do not have the answer to this question. How many anti-vaxxers' primary reason is that they're opposed to big pharma? I mean, do they use any pharmaceuticals at all? You know, like, I just don't know. But I would say we need to prioritize. One thing I didn't get a chance to talk much about was the importance of expertise and taking seriously expertise and not being completely suspicious of education and expertise in these kinds of situations. So I think the public health is a pretty high priority. It's basic.
And maybe kind of another version of that question, or some kind of follow-up from Francesca. So what if what an individual considers the collective good doesn't match what the community has individuated as the collective good? Mm-hmm. So there's a kind of a trade-off here maybe going on.
Yeah, and that happens in a liberal democracy all the time. I mean, we all have different priorities. And so that's why, you know, that's why we vote for different political parties, because we lean in different directions in so many different ways. So there are the political issues of that, and then there are the moral ones. And I think people do need to kind of navigate that space. And our values are sometimes going to come into conflict. And then, I mean, that's kind of how liberalism has evolved, to try to what's the word? To support, promote the idea of toleration and, you know, differing values coexisting in the same space. But at a certain point, it's also, just to go back to the question about governments and what is the role of governments, governments do have to make priorities at times. And right now, I think we really see the conflict between, or the tension, I want to call it, between public health and the economy. Like that is, and sort of freedom is thrown in there too, but that argument is a little less coherent, maybe. A colleague of mine actually drew a good analogy the other day. He said the debate about masks shouldn't be compared to the debate about seat belts. It should be compared to the debate, if there was one, about drunk driving. So, you know, it's not just to protect you. It's to protect us. So when we have different views of what constitutes the public good or public welfare, yeah, trade-offs need to be made. But I think in this situation, prioritizing health and slowing the spread of the pandemic, because it affects everyone and because the economy will grind to a halt, it's a good thing to prioritize right now.
Yeah, it's a collective action that also leads to common good.
I mean, what are the consequences of letting it run amok? You know, I feel like it seems to me like it's going to get worse later.
It could, yeah, if we don't do something.
If we don't do something now, early action.
So our next question from Varun, who, thank you first for a great talk. So he's asking, how does one choose the appropriate level of description while assessing their current actions? So it says, for instance, choosing to wash your hands during COVID is beneficial for me as an individual, for my family, for my coworkers worldwide. So I guess what's the questions about the level?
I think all of them, you know,
Yeah.
You can never go wrong by embedding or by acknowledging all of the different levels of description, all of the types of all of the types of descriptions that are accurate. Descriptions of actions really are just information about them. And I would say that it's important to get at the levels of description that put us in contact with the moral information, if there is any. And so I don't actually think it's a long and drawn out process. I mean, good right now, whoever knew, good hand hygiene is like one of the best things that we can do to contribute to this collective goal, this collective public health goal. And it's a global goal. It's not just within Canada, borders are permeable. So, how do you determine it? Well, why limit? Maybe I'm not getting what is there if there's an issue.
Or I guess it maybe depends to whom you're talking to.
Yeah. But I think draw attention to, my main point, if there's any takeaway, is don't let the collective context fall away. Like, you might just think you're washing hands and it's good for you and your family, but this is like a really, really important habit right now in the context of a pandemic. Really important. It's one of the most important things.
Yeah. Okay, so one more question. We have time for at least one more. From Jill, who was asking, could you please speak to the moral and ethical responsibilities of government respecting adequate care of citizens in long-term care during COVID and beyond? So there's a bit more to it, but I'm going to stop there.
Yes, I know. That's such a good question, because one of the most shocking things, I think, for many of us during this, especially early on, before I really knew, because I don't know anybody in long-term care. Well, I knew a couple people, but I didn't really know how bad it could be, how bad it was. And clearly the failure did not just start during the pandemic. The failure came to light during the pandemic. And so our government has a lot of work to do to create guidelines and requirements for much better care in long-term care. I mean, I think that has just become so obvious. It's like been horrific, and we're still experiencing horrific findings in some of the long-term care homes, and the number of deaths that have occurred are shocking. So I think this has to be a moment where all of the things that were wrong get identified and fixed, and that it is a government responsibility to put some regulations in place and things that have teeth.
Yeah. So thank you, Tracy. Time is up. It's 8 o'clock, so we're going to have to stop here. Thank you a lot for this talk and for these very good answers. Thanks, everyone, for sending very good questions. Hard questions.
Thank you for the great questions. Yeah, they were hard, good questions.
Yeah. And so just a reminder, we're going to do this again with a different speaker next week. Next week is Anthony Skelton, also from the philosophy department, and it's going to be at the same time, 7 o'clock. So on this, I would like to wish you a good evening, and hopefully we're going to see you again next week.
Thanks, Eric. Thanks, everybody.
Thanks.
I appreciate your time.